This is UNAIDS.
We're in the process of scaling up antiretroviral treatment. Millions of people are now taking antiretroviral drugs, which is tremendously exciting. But of course that brings challenges for health systems. One of the responses to those challenges has been to introduce task shifting. And there was an interesting study this month from the Free State in South Africa, which looked at the process of task shifting and the outcomes, and in particular the costs to the health service of looking after patients either with doctors leading the care or with nurses leading the care. So the outcomes of the study showed that actually those patients who were looked after by the nurse-led clinic did marginally better than those patients who were looked after by the doctor-led clinic. Surprisingly, when they looked at the costs, they actually found that the nurse-led clinics were somewhat more expensive. The costs were about $60 to $100 per patient per year more for the nurse-led clinics than the doctor-led clinics. And the reasons for this were that patients were coming back more frequently to see the nurses and spending longer at each visit with the nurse, which may of course be a good thing because it means that the patients end up better informed, and there is some evidence in their later follow-up that that these same patients are more likely to adhere to treatment going forward into the future. What this means overall is that there's no doubt that we need to task shift. We don't have enough doctors to treat everyone in central levels. It's much more convenient for patients to go to the periphery where nurses are available to look after them. But we can't expect that to save us a lot of money. We have to invest to be able to deliver such services. And the good news is that nurses provide as good and in fact probably a better service than the doctors would at the central clinic.